we hear a lot about kids being over-medicated, and we've been talking today about how the rates of medication has increased significantly since, for example, the study that you mentioned earlier. Are kids being over-medicated, or how do we account for the increased rate of medication in young people?
Yeah, so there are two types of over-medication. One is that large groups of people are increasingly prescribed medicines, and then there's individuals who are prescribed too much medicine, but talk mainly about the first one. So yeah, medication rates are gradually increasing year by year, and the last data from Pharmac in 2016 suggested that percentages of increase, particularly for adolescent girls with ADHD, has taken off, and you'd expect that because they've been underdiagnosed for years. But also SSRI use is increasing. By international standards, we're still very low in terms of how frequently we prescribe overall. So the figures are about 2.5% of young people who are prescribed mental health medication. About 1%, a little over 1% now, probably for ADHD, which is actually internationally extremely low, maybe undertreating. And the SSRI rate, the antidepressant rate, was around 1.5%, which again is pretty low. When you've got anxiety disorders with a prevalence of about 5 to 7%, and mood disorder with a prevalence of probably around 10 to 15%, they're quite low figures. So it's something to be aware of, but yeah, I think New Zealand tend to be pretty cautious, and we haven't got caught up with the excess prescribing for people with so-called bipolar disorder that they have in the States, which has been a massive issue over there. So yeah, I don't think there's widespread overprescribing. I think there will be some kids who are prescribed for where some people would think they shouldn't be prescribed for. That can certainly happen. But there'd be many, many more people where a medicine could be helpful, where they haven't accessed it, having difficulty getting into services, those sorts of things. It's a much bigger issue. And then occasionally, yeah, medication can be used in too high doses for some people, and it's often a very difficult balance. You've got someone who's on the verge of getting excluded from school, and they're not growing that well, but if your treatment's reduced, they may well get excluded, and those situations are really difficult. And we would need to be discussing that with parents and with the young person and schools, trying to encourage other things to happen that might promote inclusivity, rather than relying on the medication doing everything. So yeah, often just difficult systems